Urinary tract infection diagnosis and antibiotic treatment. Urinary tract infections, UTIs, are common bacterial infections that require accurate diagnosis and appropriate antibiotic treatment to prevent complications and ensure patient recovery. Overview. Urinary tract infections, UTIs, are bacterial infections that affect any part of the urinary tract, including the bladder, kidneys, urethra, or prostate. The most common pathogens are Escherichia coli, followed by other gram-negative bacteria. UTIs are a significant health concern, particularly in women, due to anatomical factors that facilitate bacterial growth. Pathophysiology/mechanism of action. UTIs occur when bacteria enter the urinary tract, often through the urethra. The immune system attempts to clear the infection, but if the bacterial load is high or the host defenses are compromised, the infection can progress. The mechanism of action of antibiotics involves inhibiting bacterial cell wall synthesis, disrupting protein synthesis, or interfering with DNA replication. Commonly prescribed antibiotics include fluoroquinolones, beta-lactams, and nitrofurantoin, each with specific indications and dosing guidelines. Clinical features/indications. UTIs typically present with symptoms such as dysuria, frequency, and lower abdominal pain. In women, the infection often originates from the urethra, while in men, it can ascend to the bladder or kidneys. Indications for antibiotic treatment include fever, leukocytosis, or structural abnormalities that predispose to infection. The diagnosis is usually confirmed via urinalysis, culture, and sometimes imaging studies. Diagnosis/monitoring. Diagnosis of UTIs involves a combination of clinical assessment and laboratory testing. Urinalysis can detect leukocytosis, nitrite positivity, and bacteria. Urine culture and sensitivity testing are essential to identify the specific pathogen and guide antibiotic selection. Monitoring includes tracking symptoms, urine output, and laboratory values such as white blood cell count and renal function. In severe cases, imaging studies like ultrasound may be used to assess for kidney involvement. Treatment/management. The treatment of UTIs involves the use of antibiotics that are effective against the predominant pathogen. The choice of antibiotic depends on the patient's age, comorbidities, and the severity of the infection. Commonly prescribed antibiotics include trimethoprimsulfamethoxazole, TMPSMX, fluoroquinolones, and nitrofurantoin. Dosages must be carefully followed to ensure efficacy and minimize resistance. Patients should be advised to complete the full course of antibiotics, even if symptoms improve, to prevent recurrence and antibiotic resistance. Follow-up is essential to monitor for adverse effects and ensure the infection is fully resolved. Key clinical points. 1. UTIs are most commonly caused by E. coli and require prompt diagnosis and treatment. 2. Antibiotic therapy should be guided by culture and sensitivity results to avoid unnecessary use and resistance development. 3. Women are at higher risk for UTIs due to anatomical factors, and management should consider this risk factor. 4. Monitoring for renal function and adverse effects is crucial, especially in patients with pre-existing kidney disease. 5. Patient education is vital to promote adherence to treatment and prevent recurrence. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.